is Chris McCracken, and I am a program coordinator for the Women's Wellness Connection program. Today, I will be reviewing WWC's Care Coordination Grant Program, or CCGP. I will be covering topics applicable to CCGP agencies and not to organizations solely participating in WWC clinical services. CCGP agencies must follow policies and guidelines outlined in the WWC Provider Toolkit for CCGP clients. However, in some instances, information in the toolkit is not applicable to these clients. These exceptions are discussed within this video. The purpose of CCGP is to provide breast and cervical cancer screening care coordination services to women who have or are eligible for health insurance and who meet age, income, and lawful presence criteria. The overarching goal of CCGP is to increase the number of women screened for breast and cervical cancer in Colorado. Agencies must determine if clients are eligible for WWC clinical services or care coordination services. All WWC clinical services eligibility guidelines are applicable for CCGP except for health insurance status. Eligible clients must be women between the ages of 40 and 64 years, have a family income at or below 250% of the federal poverty level, be lawfully present in the United States, and have insurance that covers breast and cervical cancer screening and diagnostic procedures. Enrollment and participation in the WWC program is voluntary. Agencies must obtain a signed lawful presence affidavit and verify required identification for each client before services are provided. Clients are only required to sign an affidavit one time for WWC, so a lawful presence affidavit signed after August 1st, 2006 qualifies as up to date. Please refer to the Colorado Department of Revenue's website for more guidance on lawful presence requirements. Agencies must also obtain a signed consent form prior to entering any data into eCast. When a client signs this form, she is affirming that she, 1, understands WWC eligibility rules and coverage, 2, has answered all eligibility questions honestly, and 3, has knowingly agreed to participate in the CCGP program. Agencies must keep the signed consent form, signed lawful presence affidavit, and proof used to verify lawful presence in the client's medical record. Clients may not be enrolled into CCGP after screening services have been provided. In other words, clients may not be referred into the program for reimbursement of a case manager's time navigating client between abnormal screening and diagnostic procedures alone. Agencies are required to comply with the guidelines stated in the patient navigation and case management section of the toolkit, except for agencies must not subcontract for patient navigation or case management services. However, any activities currently done by subcontractors, such as reminder calls or client notification of results, are acceptable. Please review the patient navigation and case management orientation video for an overview of required activities. Agencies are required to comply with the guidance stated in the Clinical Services section of the WWC Provider Toolkit, except all references in the Clinical Services section to reimbursement of clinical procedures are not applicable to CCGP. Agencies must be contracted as a Medicaid provider and/or successfully bill private insurance for breast and cervical cancer screening services. Also, approval from the nurse consultant for breast MRIs, ductograms, and those clients in need of active treatment following a diagnosis determined by excisional biopsy is not required in the CCGP. Due to Medicaid's creditable coverage requirements, CCGP clients cannot be enrolled in Colorado's breast and cervical cancer Medicaid program, since all CCGP clients are required to have health insurance. The agency must coordinate access to treatment services for these clients and establish relationships and/or subcontracts for referral sources for treatment services prior to offering screening services to any client in the CCGP. Agencies are required to comply with the guidelines stated in the Quality Assurance and Improvement section of the WWC Provider Toolkit, except the United States Centers for Disease Control and Prevention, the CDC, does not require submission of client record-level clinical measures for CCGP. However, WWC received funding for CCGP by indicating that the data on indicators would be gathered and reported in aggregate to the CDC program. WWC will review and report performance to agencies on the performance indicators shown on this slide. All state performance indicators are applicable to CCGP agencies except the BCCP Enrollment Performance Indicator. WWC will review and report performance to agencies on the following additional state performance indicator as evidenced by data in ECAST. 35% of CCGP clients 50 years of age and older receiving cervical services must also receive a mammogram. Please review the Quality Assurance and Quality Improvement Orientation video for an overview of required activities. Agencies are required to comply with the guidelines stated in the Data Entry and Documentation section of the WWC Provider Toolkit, with the exceptions. If CCGP funds care coordination for a client's cancer screening services, all related screening and diagnostic procedures must be reported in ECAST along with a funding source that is other than WWC. Client-level data for the CCGP is not submitted to the CDC. Instead, this data will be reported to the CDC in summary form. CCGP agency's reimbursement is unique and must comply with the CCGP agency reimbursement section of the Provider Toolkit. Agencies will only be paid for cases that meet the eligibility, performance, and data requirements. Reimbursement is determined by the clinical outcome of the case. Therefore, services become eligible for reimbursement when the screening is clinically complete and data has been entered accurately into ECAST. Reimbursement will occur according to the CCGP Bundled Payment System, or BPS. The amount reimbursed for care coordination services is based upon entry of screening and diagnostic procedures into ECAST, which demonstrates successful completion of care coordination services. Agencies are reimbursed more for cases where case management is provided than for cases where patient navigation is provided. CCGP agencies are reimbursed separately for care coordination of breast and cervical cancer screenings. The breast bundled payment system is shown on this slide. Reimbursement for level B7 includes coordination of care through assessment of need for screening mammogram. Agencies with documentation that a client is up to date per the guidelines and who have provided breast cancer health education or a clinical breast exam may receive partial reimbursement for patient navigation without completion of a mammogram. A B8 reimbursement includes services from level B7, plus coordination of care through completion of the mammogram to obtain the remainder of patient navigation fee. A B9 reimbursement includes services from level B8 plus case management to complete diagnostic services through the point of final diagnosis. This slide shows you the cervical cancer bundled payment system. Reimbursement for a level C7 includes coordination of care through the assessment of the need for pelvic exam and a Pap test with or without HPV testing, and completion of screenings if it's determined the client is outside of recommended screening intervals. Agencies with documentation that a client is up to date per ASCCP guidelines and who have provided cervical cancer health education may receive reimbursement for patient navigation without completion of a Pap test, with or without HPV testing. Reimbursement for level C8 include services from level C7 plus coordination of care to complete diagnostic services through the point of final diagnosis. CCGP agencies accept this reimbursement as payment in full. Clients must not be billed for these services, and reimbursement should cover costs associated with enrollment of clients into CCGP, patient navigation and case management of clinical services and treatment, and data entry of all information into ECAST. Billing statements are generated on the 15th of every month or the first business day after the 15th. Separate statements will be generated for CCGP and clinical services. Each agency has access to its own grant activity statements within ECAST, which includes client and payment information. Each agency also has access to its own budget statements to track funding amounts allocated and spent for the fiscal year. Agencies are notified monthly when billing reports are ready to be run. Agencies that are underspent in their budgets may have funds taken back and reallocated to other agencies at any time during the contract period. Subcontracts are not required for CCGP, but agencies must refer clients for additional required services such as mammograms, ultrasound, biopsies, colposcopies, or other approved breast or cervical diagnostic services if they're not being directly provided by the agencies. For more information on the Care Coordination Grant Program, Please review the provider toolkit found on the website or contact the WWC team.